Hey everybody, Dr. Kevin again here. Welcome to day 17 of our 30 days of spine rehab series, where over the course of 30 days, I hope to show you how to create a full body, comprehensive spine rehabilitation program from complete scratch in what I believe are the safest, simplest, and most effective ways possible. So the past several days, we've been doing a lot of work on core strengthening, a lot on glute activation, and a lot on hip strengthening, just to teach you the fundamentals of how to actually start to find and engage the proper muscles while also simultaneously protecting your back with all the exercises as well. So day 17, we're actually going to be rewinding the clock a little bit and just doing another posture and mobility routine, just to kind of break up a lot of the emphasis that we've been putting on strengthening, and just to revisit some of the most important parts of just mobility, especially opening up your posture and opening up your breathing. Day 17 is going to be just one of the most common programs that I prescribe to almost every single one of my patients that are struggling with any sort of postural problem, chronic lower back issue, or neck and shoulder issue from just long periods of sitting. So this is, again, just for context, we work with a lot of people out here in the East Bay that are working from home. They're working over a computer, spending just ungodly amounts of hours just sitting at a desk, which means their postures are really slumped, their shoulders are really tight, their backs are really stiff. And this is, again, one of the most effective programs to help you reverse and mitigate a lot of those issues, just to make sure that you're not letting your body get stuck or just kind of still in the same positions and postures over time. And again, this is, again, one of the most popular programs, the most common programs that I prescribe. And I just felt that the need to share with anybody else that's out there that could also benefit from something like this. So with that said, let's get into the first stretch for day 17. Okay, so the first exercise we're going to go over today is to teach you how to do back bending motions of your spine over this foam roller. This is an exercise that's very safe to do, especially on your mid to upper back. And just for context, the reason why we want to teach you how to do this is because when people are just spending way too much time in this forward bend position, their backs, especially their upper back, gets locked into this forward bend position known as kyphosis. And a lot of people struggle with their posture just because their spine is just so stiff and they can't really create the activation along the muscles of their spine to actually help them get into a proper posture. So this first exercise is designed to just help you restore some of the motion within your upper back, so that your posture just even has a chance to actually start to get better with any type of strengthening exercise that we want to do. So for starters, it's going to start on with the roller on your mid to upper back. And what you can do is just kind of just start with a just very gentle, just kind of roller up and down this foam roller here along your back, just to try to relieve and just try to do a little bit of massage of some of those muscles. And a lot of my patients just kind of feels pretty good once you just start to get, again, a little bit of pressure or a little bit of you know, massage onto those muscles, just to help break up some tension, just to help break up some knots. Okay. Now, the first thing we want to do is to just kind of maybe pick a point right in the middle of my back, right between my shoulder blades. And what we want to do here is create a backward bending curve through my upper back. And the goal is to try to be able to touch my head to the floor. Now, again, for a lot of people who are very tight, who are very stuck, who are very stiff in this area, as they bend backwards, they might get stuck or stiff like right about here. And if that's what's happening, then don't try to force the movement. Just try to stay within your limits and just try to take a couple of deep breaths in. Exhale. And as you exhale, just let gravity just kind of pull your back a little bit further down. All right. So let's try a couple more times. Breathe in. Breathe out. Exhale. Two more times. Inhale. Exhale. Breathing in through my nose. Breathing out through my mouth. Again, not forcing it, not trying to just go as far as I can right off the bat. Just learning how to use my breathing to help guide me down into a deeper stretch. So let's do it again. Breathe in. Breathe out. And let's just show it one more time. Breathe in. Breathe out. Okay, so we don't want to just stop there because our mid back is actually quite big. So we typically advise people to do 3 different segments. So we just did kind of the middle segment here. What we're going to do is just kind of work our way up a little bit more to work on the upper segment of my mid to upper back, just kind of as a form of the base of my neck. I don't want to be right on my neck, but just kind of right where my upper back starts to turn, at the top of my shoulder blade area. So same thing, breathe in, breathe out. In through my nose, out through my mouth. That's 2. And let's just practice that 3 more times. Breathe in, breathe out. I also want to make sure my hips are staying flat on the floor. Make sure my hips aren't going up in the air. Breathe in, breathe out. It's 4. Practice one more time. Okay, and then we'll go one segment a little bit further down from the first starting point. Now, at this level, I want to make sure I'm not too low because I don't want to be on my lower back or my lumbar area. I just want to stay kind of right at the bottom of my rib cage, kind of at the bottom of my shoulder blades here. And again, make sure you keep your hips on the ground because you don't want to cheat by lifting your hips up in the air. And also make sure that your lower back isn't arching too much, especially if you start feeling pressure or strain on your lower back. It might mean you're either too low or that you're putting too much pressure on your lower back to try to extend. You want to make sure that we're isolating this stretch to the mid to upper area where people are generally very stiff and very tight. So let's practice it a couple more times at this lower level here. Take a deep breath in through your nose. Breathe out. It's 1. Breathe in. That's 2. We want to use our breathing to help guide us through this stretch. All right, breathing will help just reset some of the tension within your nervous system and allow your body to relax. And don't need to force anything, just go to your limit. If you can't go all the way down, that's completely fine. Just stay within your limits, especially if this is one of the first time you're trying this exercise. No need to rush into it. Let's do it two more breath cycles. Breathe in, breathe out. And last one. Breathe in, and breathe out. Okay, so that's it for the first exercise in our postural exercise and stretch series. And let's get right into the next exercise, which will help us learn how to activate those muscles along my mid-back to help me improve my posture for a longer period of time. All right, so this is the second exercise. The first exercise was designed to teach you how to increase the mobility within your spine, just to start to reverse the overcurvature that may develop in your mid to upper back. So once we have ideally helped you restore the movements of your spine and its ability to actually get upright, we then want to teach you how to activate those muscles along your spine, just so that you have a little more endurance of those muscles so that they may have a chance to hold you up straighter for longer periods of time. So this is a very popular exercise in yoga known as the cow pose. So the exercise kind of looks like this, where I'm just trying to create a backward bending curvature through my spine and just try to, again, feel and activate all of the muscles within my mid to upper back region through here. And we want to make sure that when you're doing this exercise that you're not just creating too much bend or too much curvature in your lower back through here. That's just going to, again, create a lot of unnecessary pressure and tightness in your lower back. Instead, we want to kind of transfer all of that force and all of the energy in this mid to upper back region. So again, you might allow a little movement to happen here, but what you really want to do is just focus all of your energy and all of your effort in this mid to upper back region here, just to try to create as much backward bending in that region as you can. So one of the easiest ways to think about this exercise is to just imagine you just kind of dropping your ribs and dropping your chest down to the floor and just letting your, again, chest just kind of sink to the ground through here, okay? what you should feel is quite a bit of activation, a little bit of tightness, and just a little bit of maybe even slight discomfort within the area between this mid to upper back region through here. That is a sign that you are starting to wake up and activate muscles which may have been sleepy, which may have been dormant, or just may not have been active in up to years for a lot of our patients. Okay. Once you get down to this position where you kind of get a little stuck, where your body just kind of reaches its limit, take a nice deep breath in, exhale, and just sink a little further into the movement. Again, it shouldn't create any pain in your lower back. It shouldn't create any pain in your neck and shoulder region. You just might feel quite a bit of activation and stimulation of the muscles with that border right along your spine in that mid to upper back region. So let's try it a couple more times. Breathe in, breathe out, drop my chest down. I can push my shoulders up, just trying to maximize that curvature in my mid to upper back region. Let's do it one more time. Breathe in, breathe out. 3, 2, 1, and I'll reset. All right, let's just practice it 2 more times. So it's going to drop my chest, try to create a backward bending curve in my mid to upper back region through here. Okay, trying to not let too much motion happen through my lower back. A little bit is fine, but as long as I'm driving most of that motion through from my mid to upper back region is what's important. Okay, stick up, drop my ribs, stick up my chest, backward bend. I can keep my neck and shoulder relaxed here. It doesn't need to be, up towards the air. Just as long as you start to feel and activate some of the muscles along that mid to upper back region is what's most important. All right. Let's breathe in, breathe out, drop my ribs, stick out my chest, hold it for 3, 2, 1, and relax. Okay. Just trying to reset a little bit there. And let's just practice it one more time. So let's drop my chest, drop my ribs. Okay, stick out my chest. Pretend there's like a beach ball sitting on your mid to upper back region. And just trying to just like wrap your spine around that ball and just create as much backward bending motion as you can. And let's hold that for 5, 4, deep breath in. 3, 2, 1, and rest. So that's it for the second exercise, a very simple, popular cat exercise. But again, make sure that you're focusing on that mid to upper back region, trying to create a dip and a bend just to reverse that forward bending curve through there. And this, again, the goal of this exercise is to teach you how to activate all those muscles once we've kind of loosened up that motion with the foam roller. So that's it for the second exercise. Now let's show you the last one. Okay, so the last exercise today is an exercise known as the open book stretch. This is a very nice stretch to do because it just gets a lot done. It's very efficient in terms of just working on a lot of the important parts of your body that get affected with just kind of slumped posture. So I'm going to start by laying on my side and bring my knees up to about 90 degrees here. And I'm going to use a pillow just to support my neck. And I've doubled up this pillow because I want to make sure my neck isn't kind of like hanging down towards one side. And again, just kind of doubling up the pillow just gives my neck just a nice support and comfort. So what I'm going to do here is, again, I'm going to block my my bottom hand here on my knees. And what this is going to do is going to kind of lock my hips into place. It's also going to prevent my lower back from twisting too much, because I really want to make sure I'm getting as much twisting and rotation through my mid to upper back, because that's the area that we really want to focus on. And why I really like this exercise, again, just to kind of demonstrate it, is because it's also simultaneously working on opening a lot of the tightness that may develop in the front of your chest or in the front of the shoulder, as you might just be kind of sitting with your shoulders in a forward bent position for long periods of time. So again, just a good all-in-one stretch. Feels good to do, very easy to do, and again, just carries a lot of benefits to it. So let's just demonstrate it a couple times. So let's just rotate and twist my hand all the way out towards my right. And I want my head and neck to follow where my hands are going to go. And my goal at some point is to try to get my hands and my shoulder all the way to the ground. But for a lot of people that are very tight or very stiff, they may not just be able to do that. So just kind of go as far as you can until you kind of reach your limit. And right here, I'm starting to get a little tight and get a little stiff. So from here, I'm just going to take another deep breath in, breathe out. And when I exhale, I'm just going to let gravity in my body just kind of let me sink passively down further. Just hang out here for a couple seconds. Deep breath in, exhale. Let's go a little further towards the ground. Do 3 more times. Breathe in, breathe out. Twice more. Breathe in through my nose, out through my mouth. And one more time. Breathe in, breathe out. And now I'm able to get all the way to the floor with ease, even though my body was kind of tightening about halfway through. Again, if you're not able to get all the way there the first time, that's okay. Just work within your limits, go as much as you can, and just try to practice it as often as you can, and you will start to notice the improvement in your mobility over time. So let's practice on the other side. So let's start by laying on your side again. Bring your knees up to about 90 degrees. Bottom hand blocks my thighs to kind of lock in my lower back and hips into place, so I can really isolate the stretch and sensation in my mid to upper back region. Let's open up my left hand towards the side. Go until I start to feel some tightness or some resistance. Take a nice deep breath in. Breathe out. Just let gravity pull me a little further. If you start feeling any cramping or any tightness or any kind of spasm in your lower back here, just pull your knees up a little bit more. Maybe don't try to force yourself as much, because you want to make sure that you're really feeling as much stretching and movement in this mid to upper back region and not too much stress in your lower back through here. So let's practice a couple more times. Breathe in, breathe out. Three more times. Breathe in, breathe out. Twice more. Breathe out. As always, with all of our stretches, we want to make sure we sync up our breathing and use our breathing to guide us through the motion and guide us through the stretch. Last one, breathe in and breathe out. Okay, so that's it for today's posture stretching routine. Again, posture, there's a lot of elements that go to it, but at the core of what's most important as we're trying to improve our posture, improve our mobility, is just learning how to create better mobility within the part of our spine, specifically in our upper back. Because once we start to get those joints and once we start to get those vertebrae moving again, that makes it easier to start to be able to fire, activate, and just to start to strengthen all of those muscles, which will give us a better chance of being more upright for longer periods of time, which also means less neck and shoulder pain, which also means less lower back pain as well. So that's it for today. Hope that this helps, and we hope to see you again next time. Take care and have a wonderful day.